So one of the topics that I've mentioned already are the headache topics. We can also talk about epilepsy. So in epilepsy, there's always the question of which drug is a drug of choice for the first after fulfilling the indication for treatment of seizures. And so one of the more popular ones is levetiracetam. And the question is whether levetiracetam should be the first drug of choice for all patients, or are those who need something else. Then there is a question of what happens. People who may develop depression, and of course there is a black box warning in the anti-epileptic drugs, warning against the appearance of depression. People who are being started with this. So this is for the existing drugs. But is this a class effect again? And are the new drugs that come up to the market still need to be to have this black box warning, or maybe not? So this is again an issue of yes or no. Somebody says yes, somebody says no, and then there is a question of the new drugs. If we're talking about them, what about the new drugs? So basically, we thought that the criterion for allowing new drugs is that they reduce the seizure frequency by 50%. Is this enough? Is this what we want with the new drugs? So the existing drugs we know, but the new drugs maybe should have a higher level of before they're getting approved, and so on. And let me say also that the speakers in all of this are really key opinion leaders coming from very many different countries, starting from the United States and Europe, and of course some also local people from the Balkan countries who are prominent in this meeting because it takes place in Dubrovnik. Then there's a question in epilepsy, should patients who have a lesion in the brain, who's likely to be the causative causative for the seizures, and they're likely to be operated upon and this focus is removed, should they have intracranial recording to verify that the seizures are really causative? These are the causative for the seizures, because maybe there is a different source of the seizures in these cases. So should we go right ahead and operate and remove the lesion, or should we do the also some intracranial EEG recording? And we also go back to the old question of, do seizures beget seizures? Is the fact that a person experiences seizure, is that person more likely to develop more seizures? So now we have new data that talk to this. So again, this is something that will be brought up with a pro-con debate. And again, in a parallel hall, we're talking about seizures. So what happens after a patient who had a seizure and needs TPA, but if this patient has been treated by anticoagulants, should reversal agents be used before TPA or not? And what about people who underwent mechanical thrombectomy? Should these people in whom the thrombus was removed by a catheter, should they also get TPA intraarterially? There is a risk in that, but also benefit. So what do we do? What about lowering serum cholesterol, which is of course a risk factor for stroke? But what about people who don't have high cholesterol levels. Should they also receive anti-cholesterol agents or not? Because the statins, of course, have effects which are also outside the cholesterol or lipid domain. So again, these are things that implicate everyday treatment of people who underwent strokes, and we should really think about how do we operate this, and what are the treatments that should be given, looking at this as a personalized medicine issue. Then there is a general question. We just had Women's Day yesterday all over the world. Do women get the same access to stroke care as men? And again, that's an important issue, and we're going to discuss this in pro-con debates, and so on and so on. So we're going to discuss again 8 or 9 stroke topics.